Okay, thank you. Debbie, let's move on to health issues.
Yeah, let's. So I've been very fortunate in following a friend and UK column viewer, her journey in the NHS. And I just want to define what is data, because as we've heard from Ben Rubin many times, data is very important in the NHS. And we've got platforms and companies like Palantir involved who are attached to the CIA. So data is the factual information, such as measurements or statistics, used as a basis for reasoning, discussion, or calculation. And then we look at data mining. What is the definition of data mining? So according to Merriam-Webster, the data mining is the practice of searching through large amounts of computerized data to find useful patterns or trends. Well, that's very interesting, because what I want to find out is what is going on in the NHS to possibly many people that are watching now. And this is probably news that some people may have heard of and some people may not even know that's going on. So the Royal Cornwall Hospital Trust sent my friend a letter, and on the letter it says, for an appointment, you will be contacted by Ultramed, an online pre-assessment to complete a questionnaire prior to attending for your investigation. Please note, if you fail to complete, this may result in your procedure being delayed or cancelled. You will be required to answer questions about you, your health, and your procedure. So it's like, really, who are Ultramed, and do we have a choice? Is there a choice, or have we got to fill in this questionnaire? So I went to have a look at the company Ultramed, and what Ultramed say is that they work with healthcare professionals to deliver cost and time-effective solutions for pre-operative and pre-procedural assessments. Our person-centered approach ensures we offer products that work not only for the healthcare provider, but for patients too. So what are the benefits then of using a company like Ultramed? Well, it's interesting because the benefits, of course, aren't to us at all. They are to the NHS long-term plans. So the key benefits of Ultramed is that it facilitates the long-term plan. This is to reduce F2F, means face-to-face, to reduce face-to-face outpatients consultants by a third. Also saves clinicians time, because it's you that's going to be entering the data, which means that the clinician doesn't have to. So you're going to be doing the work. It also means that your test results are going to be available apparently before a remote face-to-face consultation. And let's not forget the carbon reduction, of course, because people won't need to travel. All they'll need to do is input their data, and there's no upfront capital cost. So clearly you can see that there are plenty of benefits for Ultramed.
Right, sorry, Debbie, just before we move on for that, I just wanted to look at the last one. So procurement is from G-Cloud 12. So we're looking at Google Cloud. This is where this data is being stored.
Oh, we'll come on to that again in a minute. Yes, we can see exactly where the data is being stored. It gets even murkier. But who are Ultramed working with is what I wanted to know next. And there's a whole array of NHS trusts that they're working with. Is yours one of them? But having said that, as we'll come on to in a minute, you don't actually have to be in that NHS trust to get an invitation for Ultramed, but we'll look at that in a minute. But Ultramed have been receiving awards as well. And on the 27th of June this year, King Charles awarded Ultramed the King's Award for Enterprise in Innovation. And Paul, who's the CEO of the company, we'll come back to Paul in a minute, he had a great time receiving this award. So let's look a little bit deeper at Ultramed, because they're also, you'll see a couple of things that you recognise in the next screenshot. You'll see that they're funded by Innovate UK, which is a technically funded from the government for innovations for the UK, all part of the life sciences agenda. And there you can see, I had to highlight it in yellow, is the MHRA. So I can assume from this that the data that you input gets sent to the MHRA, of course, like the CPRD website, the CPRD, register that goes to GPs. So we've got a lot of involvement with the MHRA. But who's Paul? Who was the Paul that had a great time when he went to get the award? So Paul is Dr. Paul Upton. He's the co-founder, along with Alan Sanders, who's the creative design director. But Dr. Paul Upton is actually a consultant anaesthetist. And he was at the Royal Cornwall Hospital Trust. He's also been in a few working groups of NICE. But he actually started this organisation back in 2014. But it all started in Cornwall, and their headquarters are based in Penryn, down here. But they're not just in the preoperative business, which we'll see in a minute. They're also in outpatients. So if you want an outpatient's appointment or you're waiting for an outpatient's appointment, it could be that you receive a text asking you to access a link which will take you to Ultramed, where you have to enter all of your details for your outpatient's appointments. This covers all sorts of outpatient appointments. As you'll see in the next slide, we've got breast surgery, ophthalmics, urology, lower gastrointestinal, upper gastrointestinal, gynae, rheumatology, you name it, you've got it in there too. And then also when we go to the pre-op, because don't forget they do pre-op as well, and we look at what they're looking at in the preoperative assessment. So they'll send you a text to ask you to fill in a whole questionnaire. We're looking at, they've got a KIDS. They've also got one for cardiac catheterizations and cardiac investigations, endoscopies, so colonoscopies, gastroscopies, sigmoidoscopies, etc. And IR that stands for interventional radiology services. So do you have to fill in this questionnaire? And actually, when you go into the website and start looking at their privacy agreement, you can see that it clearly says, if you decide to register with us and one of our software products. So actually, you don't have to fill in this questionnaire at all. However, if we go on and go further into their privacy policy, you can see the disclosure of information. And actually, if you do decide to register with them, then you can be sure that your personal information is going to be made available to all sorts of people. Their subsidiaries is what they call them. So you're talking business partners, suppliers, subcontractors. In fact, they can pretty much disclose your information with anybody they want. But where is this information stored? And as Mike rightly said, we were looking at Google earlier, but where they're storing it, they say that it has to be transferred to outside the European Economic Area, the EEA. And this is due to our hosting site, Squarespace, being outside of this area. We always ensure your data is only transferred in full accordance with UK data protection laws. By submitting your personal data, you agree to this transfer, storing, or processing. We will take all steps reasonably necessary to ensure that your data is treated securely and in accordance with this policy. Now, Squarespace, I can tell you now, is based in the USA. In fact, its headquarters are in New York, and it was funded by a £30,000 grant by a guy called Anthony Casalina, and he founded this ages ago. So it's been one of these up-and-coming new innovative companies, but basically your data will be stored in New York. So if you want to find out more, you can go through their website and look at the preoperative questionnaire that they ask you to fill in. And you'll see there that they've also been endorsed by the Association of Anaesthetists. So pre-op, but I would encourage everybody actually to go into the website. But I've been looking very closely at how my friend has been dealt with Ultramed. And when she went to her initial appointment, her outpatient's appointment, of which she'd had to register online, which she didn't like doing, as soon as she'd had her appointment, she was red alerted for an invasive procedure. She thought she'd get a letter, But no, literally within hours of leaving the appointment, she got bombarded by texts, and she very kindly allowed me to screenshot the texts, and she was getting them on a daily basis until I said to her, why don't you phone the hospital and say that you don't agree to signing up to the privacy policy of Ultramed? There has to be an alternative. They have to offer you an alternative. And when she did phone the hospital actually agreed with her and said, no, we agree. We wouldn't want to sign that privacy policy either. And we wouldn't want to answer very, very intimate questions. And the questionnaire is quite detailed. So she did get an appointment by refusing to go on to Ultramed, by refusing to decide to register with them, and by insisting that the hospital gave her another alternative. So this is a choice, so you're not forced into doing this. However, my great thanks to Stefan, one of our viewers, who, after I hinted about Ultramed last week on Extra, wrote this email to me to say that his partner had also been bombarded by Ultramed. Now, his partner's in Devon, and Devon isn't actually one of the NHS trusts that Ultramed say they're working with. So clearly, the information is going between trusts, and Ultramed are getting their tentacles pretty much everywhere. And very sadly, Stefan's partner has declined to fill it in and seems to have dropped off the radar. And this is what I'm worried about, is that many people are saying they don't want to fill it in, quite rightly. And I'm saying, don't fill it in, just say no, because there is an alternative. There really is, but you must contact your hospital and say that you don't agree to signing up to any of these privacy agreements with any of these companies. Just say no.
Okay, thank you, Debbie. And just sticking with health for a little bit, let's just bring this on screen, because this is Harvard Medicine and their latest report here, COVID's damage lingers in the heart. Researchers increasingly find that the effects of infection by SARS-CoV-2 extend to the cardiovascular system. This is what they say. As the COVID-19 pandemic was getting underway in early 2020, doctors in Wuhan, China began to report that many patients hospitalized with the disease had cardiac injuries. Heart attacks were frequent, especially in patients with underlying risk factors, and there were numerous cases of myocarditis, which occurs when the heart muscle layers become inflamed. Roughly a quarter of patients with severe COVID-19 had elevated blood levels of troponin, a protein marker for cardiac damage. And it goes on to say that hospitalizations and deaths from COVID-19 have since fallen off, the result of widespread vaccinations and the population's growing immunity against severe disease. But SARS-CoV-2, the coronavirus that causes COVID-19, is still with us, along with the risks it poses to heart health, especially in people with blocked arteries, hypertension, diabetes, and other predisposing factors. Millions of people who recover from COVID-19 have gone on to develop lingering cardiovascular symptoms, including abnormal heartbeats, dizziness, and shortness of breath. And of course, this article doesn't discuss effects of vaccination at all. And so my question is that if we believe what this says, and they claim that SARS-CoV-2 creates heart issues for people, then and we are basing our vaccination regime upon the key toxic element within SARS-CoV-2, which is a spike protein, then if they were aware that SARS-CoV-2 was creating heart problems in 2020, how were they not aware of the potential risks of heart problems as a result of the vaccines? How could they ever have made the claim that the vaccines were going to be safe? There are a whole bunch of questions around this that need to be asked. But I just want to very briefly then follow up with this, and this is the latest from the MHRA, new guiding principles for predetermined change control plans. And this is pretty problematic, really, because this is about AI and so-called machine learning with medical products. So any medical products that are associated with AI and machine learning in particular, because it's very concerned that whenever a new medical product is created or a medical product is amended in any way, it has to go through a regulatory process. And if at the back of your medical product is AI or machine learning, then there are new versions of that rolled out on a regular basis, and the regulatory burden would be just too much for the MHRA. So they want to create these predetermined change control plans, which means that these companies don't have to do any regulatory assessments at all as they amend their products or develop new products and so on. So they're claiming that they've got 5 new principles around that the products need to be focused and bounded, risk-based assessments done, evidence-based assessments done, transparency has to be there, and total product life cycle perspective, whatever that means. That means to improve the quality and integrity of a PCCP by continually considering the perspectives of all stakeholders. Of course, the stakeholders don't include UKRI that are on the receiving end of these products, but this is all about reducing the regulatory burden on the companies that are producing these products, and therefore, how can there be proper safety evaluations if effectively the regulatory burden is removed?
Because they don't want any safety factor in the development of these experimental vaccines, Mike, is the answer to that one.
Yeah.